Hey guys, my name is Mavi, and for the last 14 years, I've worked in the plastic surgery industry under top board-certified plastic surgeons. In that time, I have gained extensive knowledge about surgical procedures, pre- and post-op care, as well as non-invasive or minimally invasive treatments. My passion to educate and help women feel empowered in their surgical decisions led to what we now know as the Big Butts No Lies podcast. Join in on the fun as I chat with plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun! All right, guys, I'm so excited about the episode I have for you today. And my guest is so amazing and talented. I can't even really explain it to you guys how obsessed I am with her because she is a boss. She is a mom, and she's a talented plastic surgeon. She's a friend. She's amazing. She's friendly. She's everything you want in a girl crush. So let me introduce Dr. Danielle Andry.
Hi, guys.
Dr. Andry's here in Houston. So whenever I talk about her, we're here in Houston. She works out of, are you still just out of St. Joseph's Hospital?
Mostly out of St. Joseph's Hospital. Every once in a while, we will go to a couple other hospitals, but I would say like 95% out of St. Joe's.
Awesome. Okay, so today, Dr. Andry, I want to talk about you and kind of celebrate you. You did an amazing procedure for me that I want to talk about in length in a minute. But I know there's been a lot of changes for you guys, and I want you to tell me about it.
So I am a plastic surgeon in Houston, as you said. I actually started my practice with my husband, who is also a plastic surgeon. So we have kind of that's always been our dynamic, is that we have a very kind of family-oriented practice where he and I, while we don't really work together, we kind of have two separate practices. We do work together in that we have the same practice, and we kind of see each other's patients if need be. We are very willing to, if he's going to be a better fit for you, then I'll send you over to him. If I'm going to be a better fit for you, he sends you over to me. And so we have always been kind of the backbone of the practice. But as many people who have practices know, there is a little bit of turnover, and then also you grow bigger and you start to find more niches that your patients really want. So recently we decided to hire an esthetician. Our office has a membership where we do things just to kind of keep your skin really fresh, and you have a monthly treatment that you do to kind of keep everything up to date. And that was getting a little bit overwhelming for us. So now we have an esthetician who's going to be taking over some of those things. We've listened to our members and we've expanded a few things. So she's added a couple facial options.
The hydrofacial, right?
Membership. Well, the hydrofacial is not part of the membership, but she has I think it's an oxygen facial and a chocolate facial, which I haven't had, but I'm super interested to have.
Ooh, that sounds fun.
And so she's going to be offering those treatments as part of the membership. And then, of course, if you're not a member, you can obviously get those treatments, but it's just not free every month. And then the hydrofacial, which I have personally wanted to get in my practice since I was in residency, had one as a demo at the aesthetic meeting, and my skin has never looked or felt better. So I've been secretly wanting to get that just for myself, and finally convinced Dr. Wijay that it was his idea, which is what I have to do in order to get anything that I want.
Yes, absolutely.
As most wives know, convince him that it's your
his idea.
To get red bottoms, and you'll get them. So we just got the hydrofacial. I am still obsessed with it. I love it. I just had my first treatment of our machine, which we got the one with all the bells and whistles and everything like that. And Raquel is a veteran esthetician. She's a veteran of the hydrofacial. She's been doing it for years. And she really just knows what she's doing. She's great at doing skin assessments, great at kind of picking products that are going to really help you as far as your skincare line, so that you just have something that you're treating with every single day to really get your skin up to shape, but also, preventing that aging from happening as we get older. I mean, so many of us look at our moms and we're like, don't really want to wind up there. So doing things that are going to really just help you keep the skin that you have right now and make it better.
I love that. I'm a huge advocate for you have to stay on your maintenance. We're reversing the clock, but it continues.
Yes, exactly. And so the other thing that we're going to be having starting pretty soon is we're going to have another injector that's going to start with us. And as I always say, I always think that former patients make the best employees.
Yes, they do.
Because you've seen them at their worst. You've seen them go through obstacles. You've seen how they've handled, the consult process, the pre-op process, the post-op process. If they're compliant, if they show up to their appointments on time, all of those things.
You know everything about them by the time.
Exactly.
Yeah, you're right.
One of our former patients is going to be coming on as our nurse practitioner to do injectables. She is just the sweetest, biggest heart, smartest, she is just a rock star. And so we are so excited to get Melanie on board.
I'm so excited about that. I personally know Melanie and I love her. She was great. Every time she walked into the office, I was like, oh my God, Melanie's here. I'm so excited to see her. And I could smell her coming down the hallway. So I can't wait to come see her.
Yeah. And I think that you hit the nail on the head is that when Melanie walks into the office, it doesn't matter if you know her or don't know her. Everybody has a smile on their face. She just lights up the room.
Yeah,
and
she does.
She also has just such a wonderful, aesthetic eye where she just sees things. And that's something that you can't teach. And we're so blessed to have her.
I'm excited. And next time we have you on, let's bring Melanie on too. That'll be great. Once she's,
she would love that.
Yeah, I'm sure she would. She would be so excited to come and talk. So when is she going to be starting?
She is going to be starting in the middle of this month.
Oh,
She's just
awesome.
kind of wrapping up some things. She just finished her nurse practitioner doctorate, and so she's going to be ready to go from there.
Awesome. So, Dr. Andry, you and I know that I am obsessed with you. With your talent. I am amazed at just how you are so gifted at me bringing you a problem and you giving me a solution that I had been looking for years. And you easily, this is what we can do. So that procedure that I'm talking about is what we coined the bra procedure, which is a breast reduction augmentation with breast implant. So let me tell you guys how this even came about. I've always had large breasts, but women with large breasts know they're lower. I don't have that upper pole fullness. It was more lower on my chest. And I had nursed 2 kids for over a year. So my breast needed some help. And I talked to Dr. Andry. I talked to her in the office and I told her, okay, this is what I want. I want my boobs to be smaller, but I want them to look like implants. I want them to look not like implants, but I want them to look like fuller cleavage. And I know with most traditional breast reductions, you don't really see that. So when I brought that to Dr. Andry, she told me, what'd you tell me, Dr. Andry?
So I said, well, let's just do it like a breast reduction. Let's remove a little bit extra tissue and let's remove some of that extra tissue that I would have left behind with an implant that's going to kind of just be like that internal push-up bra that's going to give you that upper pole fullness that you wouldn't have, without an implant.
So with the breast reduction, you remove a significant amount of tissue, right? And then you kind of overestimate, or is it underestimate, to fill in for that amount of the implant? So you remove more, right?
I remove a little bit more. And, this kind of stemmed from, irregardless, and I do a lot of procedures in just my regular mastopexy or my regular breast reductions to try to get everything lifted, tighter, all that kind of stuff. And then you can always do something called an internal bra, which is like a internal mesh bra type of thing to keep everything up. That does go away over time because your body eats it up. It does help with some of the longevity of your result. But even with that, I found that patients were kind of losing a little bit of their upper pole fullness. And that wasn't just in my practice. It was people coming from multiple other practices that had the full shebang, all of that, and still just felt like they weren't getting that augmented look. And I was like, well, you're never going to have an augmented look if you don't have an of. So that's kind of the crux of it. And so you don't need to have a big implant necessarily. And it took me several times of kind of doing this procedure and honing in on it to find out which implant was going to be the best for that. A couple times I think I went a little bit too wide, a little bit too flat, a little bit too big, a little bit too small. And so now we've really narrowed it in and dialed it in. And I think that Mavi can attest that she's very happy with her result. And, I would say 99% of my patients that I do this procedure on are just super happy with their results. It's just exactly what they wanted.
Breast reduction patients and breast augmentation patients are usually the happiest, right? Would you say? Your breast and your...
I would say that too.
So imagine both of those things in one patient. So breast reduction and breast aug.
Mm-hmm. Well, I will give the caveat that, sometimes it is definitely a more complicated procedure, that you're having two kind of major things going in opposite directions. And it takes a lot to get it all together. Whenever I'm explaining this fully to patients, you have a lot of factors going on. So we have to factor in your skin position, your nipple position, your skin tightness, your breast tissue tightness, your breast tissue volume, where your implant is. So the pocket of the implant, and then also the type of implant, the profile of the implant, the size of the implant, the cohesiveness of the implant. That's a lot of factors to bring all in together. And so a lot of people will stage this procedure to do the breast lift first and then the augmentation, or the augmentation first and then the breast lift or reduction. If we're combining the two, I always tell my patients while we're trying to get this done in one procedure perfectly, we're asking for 10 to 12 factors to all come in together perfectly. So don't be surprised if we do have to do just a little tweak afterwards to get everything perfect. And
that goes with most plastic surgery. I mean, tummy tucks, liposuction, your surgeon is always aiming and, doing their 100% best for you to have the best result with nothing else needed. But there's a lot of factors that come into play. And sometimes you do need revisions and you do need a little bit of touch up or a little bit of change. And those are just things that when you go into plastic surgery and you're thinking about these procedures, you should have that in the back of your mind that you might need another one, or you might need more than one procedure to fix the problem that you have. For example, that would be tummy tuck and liposuction to the front of your abdomen.
Yes, that center portion of your abdomen. The other one that we will do together, but I kind of prep patients in that, look, this, you may need a little bit of touch up just because of the way that two things are going opposite of each other, is the tummy tuck with the VBL. And so that's the one that we'll do together. But just don't be surprised if you need a little bit of extra fat in your booty, or you need a little bit of a touch up or something like that, because you have two things kind of going in opposite directions that are having to heal perfectly. There's a lot of factors going on, not just in the operating room, but also as you heal. And so if everything isn't optimized, both, from all different perspectives, a lot from your anatomy, what you're starting with pre-op, but also the way that your body heals. And a lot of times we don't have too much control over that, but in the things that we can control, like getting in the right baja, getting your lymphatic massages, being able to offset pressure from your booty as much as possible whenever you've done the tummy tuck. That's one of the reasons why some people don't combine that procedure, because it's a lot of factors that have to come together to get you that perfect result.
So, Dr. Andry, tell me, who is the perfect candidate for the bra procedure?
I would say the perfect candidate is somebody who's about a double D size and wanting to go to a full CD size. If you are somebody who's bigger than that, maybe an FG, with the amount of tissue that we're having to take off, and with kind of the size implant that we're going to have to put in to fill that chest and make it a little bit rounder, you're going to wind up with a little bit of a bigger breast than what you may be looking for. And then to the other side, if you're wanting to be really small, like a B cup size, then that augmented look is going to be very hard to get. as with all plastic surgery procedures, you want somebody who's super healthy, high protein intake, has realistic expectations of what their body can look like. You're not going to look like a person who is completely flat and got a 450cc breast augmentation. That is just not what you're going to look like. You're going to have a little bit of skin overhang. There's no way that we can get rid of that, even with the lift, because gravity works. And so
you guys, she's saying that because that was me asking her, I want to look like I was flat and got like a 450, 500cc implant, because that's how large my breast look.
And yes, you cannot come in with size, triple D boobs and, ask for this procedure and give me a goal picture of Emily Ratajkowski. Like, it's not going to work.
That's why it's so important for you to be open with your surgeon and for your surgeon to be open with you and for you to accept what they're telling you. If they're telling you, hey, this might not be, realistic, accept that and, kind of process it and follow their advice to what they're guiding you to.
150%. And I try to, if anything, undersell my patients, because you always want somebody to be pleasantly surprised, but not disappointed. So
that's true.
So I always try to undersell the results a little bit. But while goal pictures can be very helpful in trying to get to that idea of a goal, I find that they're more helpful in gauging that patient's expectations.
Absolutely.
And rerouting them, because I've had that example that I gave of the triple D. That was not you, Mavi. That's like 25% of my patients come in with like, they're a solid like BMI of 28 or something, like they're a little bit of a bigger girl, they have a little bit of a bigger chest. And then they show me this, they show me like Kendall Jenner. And I'm like,
I remember.
Or they show me like Chloe's boobs, and I'm like, honey, like it's just, you have to look in the mirror, really. Mm-hmm. And I'm not trying to be ugly about it. It's just
no, definitely not.
Understand that if I could make everybody look like Kylie Jenner or like Khloe Kardashian or any of the Kardashians, do you know what kind of line, like you would not be able to get into my practice for 10 years if I could take somebody who has a BMI of 28 and bring them down to look like one of the Kardashians. Like, it's just not possible. And anybody who can get them to that look, I mean, you also have to realize that a lot of these before and afters that you're seeing on Instagram are doctored.
And
or they
round
have
two.
Lighting, yes, or round two.
Mm-hmm.
And so whenever your surgeon says like, hey, honey, in one go, we cannot get you all the way to here. It's just
not safe or realistic.
And it's exactly. And I see a lot of, nurse injectors put memes and stuff like that on their Instagrams. It's like, I want the Kylie look, but can you spread that 1 cc of filler around my face? It's kind of like that with surgery too, like you can't come in and say like, okay, I only have X amount of dollars to spend. I really want this result, but I want you to get me there with only the procedure that I want to do. And we see that a lot with breast augmentation, with somebody who actually needs a lift. They're like, well, I don't have money for the lift, but I want this look. Well, in order to get that look, you have to do the full shebang. And so it's definitely a give and take relationship. And you really need to listen to your surgeon, because so many times I'll tell patients, we cannot get you to this result with all the tools that I have, or with just the tools that you're allowing me to take on you. And despite how many times I tell some of these patients over and over again, that's not an achievable result, they come in post-op and they're like, but this was my goal picture. Like, we talked about that. And so it's just so important to really listen to your surgeon and then go back, find some more realistic goal photos, or ask your surgeon, show me somebody like myself or similar to myself that you've done, and kind of what my result can be. And realize that is sometimes hard, because so many people, their bodies are so different. They're starting off at different starting points, and they have different goals. And so it's very hard to find two people that are exactly alike. So your surgeon can probably give you an idea of someone similar to you. It may not be the exact procedure, but just to get an idea of where you can get and see if that's something that you're willing to go through the procedure, the time, the money, the investment, all of that to get to that point.
I'm so happy that you just said all of that, because you know that I want the patients to be 100% happy and sure and confident with their decisions. And these are, whenever we tell you, or I tell you, when you go to your consultation, ask your questions, weigh out your options. These are the types of options that you're weighing out. Is it worth the investment, the amount of correction that I'm going to get, or if as close as I'm going to get to my goal, is it worth the investment? And sometimes it's not. For some women, it's not. So it's so important. And as you can tell, I think in this conversation here, I love having a female plastic surgeon because she's real. I feel like she's my friend. She understands me. She is a mom. She has the same body parts that I do. So she understands what I'm talking about. And I advocate for you to go see a female plastic surgeon before you make any, decision. At least see if you're going to 3 consultations, make one of them a female. And if you're in Houston, Dr. Andry.
I appreciate the plug, Mavi, but I would agree with that. I think a better point too is just whenever you're getting your 3 consultations, don't pick 3 people that are all, the exact same demographic. Don't pick 3, 55-year-old males that, all came from the same training and background and everything like that, because you're probably going to get a similar, thing across the board.
Uh-huh.
Pick maybe like an older surgeon, a younger surgeon, a female surgeon, an African-American surgeon, a Indian or Asian surgeon. Like pick somebody who's got like a little bit of a different background, a little bit of a different, anatomy to themselves, a little bit of a different patient demographic, and kind of see what they have to say. And then also, look at their website, their Instagram, see if you vibe with their aesthetic, because a lot of surgeons just have different aesthetics. Some of my counterparts, are boob guys. And so every single one of their patients have really big boobs.
They have larger implants.
You're wanting a broad procedure, that's not going to be the person you're going to want to go to.
That's definitely right.
They're going to get you bigger because that's just,
their aesthetic.
I mean, that's their aesthetic. They tend to push harder on implants. Also, the thing that I would say, and this is totally a personality thing, is if you want to go to a surgeon that tells you what size implant you should have, then you have to go to a certain surgeon that's going to tell you that. And then other surgeons will kind of guide you along that process, but ultimately you're going to be the one that's going to pick out that implant. And so
that's a personality
style thing.
Yes, that's definitely
another style thing. And that's something that you have to jive with that surgeon about. If you're somebody who wants to walk in and say like, I want to be a D cup size and that's it. And that surgeon's going to say, okay, well, then we need to put in this implant. Then you're not going to fit well in my practice, because I like to have that conversation with the patients. But some patients don't jive well with me because they just want somebody to tell them exactly what to do and not have that conversation because they just feel overwhelmed or, don't want to be part of that decision-making process. And that's totally fine. I'm just not going to be the surgeon for you. And you just need to go to multiple consultations to understand those nuances. And then a lot of people, I think, Mavi, just don't know that there are different styles to picking out implants. I've had a lot of women who've come to me, 20 years down the road, and they're like, I don't know what size they put in me. I just said I wanted to be a D. He just stuck an implant in. And then whenever they go through the sizing process with me, they're like, oh my gosh, this exists. You can pick out your implants. Like,
can you give me an example? Can you give our listeners an example of just the different, when you're explaining to a patient the options for implants. Could you give me an example so our listeners can hear that?
So I mean, there's a ton of different implants. So most basically, you have saline and silicone. I would say probably the vast majority of patients nowadays are picking silicone just because they are softer, more natural feeling. The newer technology makes them safer than the old generation silicone. They're also a little bit lighter in your body. And so most people are going with those silicone implants that are termed gummy bear with that newer generation silicone. So going from silicone, you have like low profile, low plus profile, a moderate profile, and in some brands you have moderate plus, moderate high, high profile, ultra high profile. So those are all the different profiles of implants. And that's hard to say on a podcast.
What is the profile? The profile is
how much, it's kind of the height to width ratio. So the higher the profile you go, the higher or the larger that height to width ratio is. So the more narrow the implant, the more projected the implant as you go up in the height per cc, I would say. But whenever I'm sizing patients, I tell all my patients, don't focus on letters or numbers because to me, they mean nothing. And I give them the example of this is a 375cc implant that's a moderate profile. This is a 375cc implant that's an ultra high profile. Look at these two implants. They are totally different and they're going to give you a totally different result. So get numbers out of your head. And then I say, get letters out of your head, because if you say that you want to be a D cup size and you go to Victoria's Secret versus Nordstrom's and get fitted there, they're going to be totally different sizes. And then also whether you are a 32 around, a 36 around, that cup size is going to be very, very different. And so what you may think is a D is going to look completely different than a D on somebody who is, a 32 around. And whenever you're bringing in before and after photos, that's another thing that you need to look at is what is their band size compared to my band size? Because you can't say, I want to be the double D of somebody who's a 32 around and I'm a 38 around. It's just not going to work out.
That's right.
And then there's also textured and smooth implants where I think most, if not all, plastic surgeons are staying completely away from textured implants nowadays, that there is that risk of the lymphoma associated with only those textured implants. So I don't think many, if any, plastic surgeons are putting in textured implants, at least in the States nowadays. And then there's also the cohesiveness of the implant or the fill level, depending on what brand you're going with. We tend to use the Natural Allergan implants. And so those have the responsive, which kind of fits more of a teardrop shape, the soft touch, which has a little bit more upper pole fullness, and then the cohesive, which has a lot more upper pole fullness.
The soft touch is what I have. Yeah, because I wanted that upper pole fullness. I would say
majority of our patients are picking soft touch. People who are wanting that kind of more natural teardrop shape are picking the responsive. Rarely have anybody who is not undergoing some kind of reconstruction go with the cohesive level. And then I know Mentor has like the ultra fill or the extra fill, and then Sientra has two different cohesiveness. And then there's also those variances in the different brands. Some of them feel a little bit softer, some of them feel a little bit firmer. Allergan does feel just a touch firmer than the Mentors do, but I think that firmness helps with
maintaining that
with maintaining that upper pole fullness. And then also one of the reasons why we use Allergan is because just anecdotally, I think that Mentor has a little bit of a higher rupture rate, but that's completely anecdotal. There was a paper that just came out that has, to me, a little bit of a concerning rupture rate on the Mentor side of things. I'm not trying to bash Mentor, but that's just the reason why I personally prefer Allergan and Sientra for my implants.
So as you guys heard, all of those things come into play whenever you're picking an implant.
Yeah, and I realized that was very overwhelming. That's a lot of stuff. That's why you need a consultation with somebody who can show you these differences and go through all those differences, because that's just a lot of information to process, especially over a podcast.
Definitely. And this also kind of reinforces that point that I made in the last episode of if you're not meeting your surgeon and having a consultation and they're going over all of this with you, I would, before your surgery, not the day of your surgery, before, weeks before, I would probably second guess or maybe take a little step back and reconsider, maybe see some other consultations, just because there's so much that goes into play when you're picking an implant or you're putting together a surgery plan, that if you're not meeting with your surgeon, who's the person that's going to be doing this procedure on you, I would think twice if you're not meeting with them before surgery.
I would definitely agree with that. And just kind of to that point, and again, this is just a style thing, but I have patients try on implants, go through the whole shebang at their consultation, and then we retry on implants at the pre-op consultation. And a lot of times I'm re-going over that entire thing, because the first time that you come in for a consult, it can just be very overwhelming. There's been multiple studies showing that patients only retain a certain percentage of what you tell them. And so whenever you're going over all of this information, it can be a lot. So I have patients, retry, re-go over everything at pre-op. And then I even have some patients come in for a second or even third consultation to re-go over everything, just so that they can really wrap their mind around it.
Definitely. So write down your questions at that initial consultation. Write down as much as you can, or whoever goes with you, have them, jot some notes down just to jog your memory when you go home and you're talking about it with your significant other or whoever you're going to talk to about it while you're preparing your finances. Mm-hmm. Have somebody, jot down some main points. And the point of building a relationship with your plastic surgeon and your plastic surgeon's staff is, some of these questions are easy. You can call your patient coordinator and she could probably answer that for you. For example, one of those questions is, am I going to spend the night? Your patient coordinator will know, no, you're not going to spend the night, or yes, you are going to spend the night. So these are all questions that come up, and I cannot tell you enough. It is so important for you to build a relationship with your surgeon and your surgeon's staff.
Yes, I agree with that. And then I was also going to say, like, if that surgeon's not offering you the option to come back in and talk with them again, that may also be a little bit of a red flag. I mean, I know that there are a lot of surgeons who are extremely busy, and being able to fit somebody in for a second consultation is difficult. But at the same time, you need to be confident in that plan. Because if you're not confident in that plan before you go into surgery, you're going to have more doubts after surgery.
Absolutely.
So you just need to be confident in your plan before you go to the operating room. I would also encourage patients to bring someone else with you, whether that be your girlfriend, your husband, your mom, sister, whatever. Bring somebody else with you, because you're going to retain some of that information. They're going to retain some of that information, and you're going to want somebody to bounce these ideas off of, bounce these questions or concerns that you have. So you want somebody who is there with you to be able to talk those things over. The other thing is, I do have some patients either videotape or record, like press a voice record of our conversation. And I'm totally happy with that, because that allows you to revisit that consultation. We also have Touch MD for our patients, where I basically go over a consultation, kind of my basics with everything, so that you can re-listen to that and revisit all of those salient points that I really want every patient to hear. And so those are all things that we have in our office, or options that you can have that allow you to really kind of revisit those things, because you need to hear it more than once.
You're absolutely right about that. I 100% agree. We're on the same page. Dr. Andry, okay, I want to ask you to tell us a little bit about a procedure for our lady parts that most women don't even know is out there.
Yes.
This conversation stemmed. Yeah, we were having a conversation about it.
So one of the procedures that I do a lot of are labiaplasties and vaginoplasties. Labiaplasties more than vaginoplasties, just because I think a lot of OBGYNs are also doing the vaginoplasty type of thing, or sometimes you need a bladder lift at the same time, but I'll explain the two. A labiaplasty is for the labia minora, so kind of the inner labia that hang down. And then a vaginoplasty is a tightening procedure for the vaginal canal, or the inside, as well as sometimes the perineum, or kind of that outer area that sometimes gapes open. a lot of patients have never heard about this. And the way that a lot of my patients come in is they had no clue that this existed. They were just somehow it came up in conversation with their girlfriend. And they were like, their girlfriend says something about, oh, I had this procedure done. Now I don't have to spend 30 minutes tucking my labia in before I go out to the pool. And their friend is like, what? I have that too. I need that. And so a lot of people just don't talk about it.
It's word of mouth.
But yeah, it's completely word of mouth, or they just stumble upon it somehow on the internet, which it's hard to because the internet puts a lot of restrictions on what things we can say, and that's considered sexual, where I think that it should be educational. And then some people have that stigma that it's like, genital mutilation or something like that. I could not disagree with them more. It's just so many women have this problem. And while it is a natural variant of anatomy, and there's absolutely nothing wrong with people who have longer labia, I will say that, the same is true for patients who have really big breast and back pain issues and all that kind of stuff. Whereas people who are getting a breast reduction there's no stigma associated with that. Whereas there is this stigma for some reason associated with labiaplasty. A lot of women have pain just on a daily basis, or with working out, or with intercourse. A lot of patients are having to, like I said, tuck things in for 20, 30 minutes. They're having to run back to the bathroom to check themselves out at the pool every 20, 30 minutes because they're so self-conscious that something's slipping out, or they look like they have a bulge there, what have you. They can't wear lace panties. They can't feel sexy in lingerie because they just feel like things are just falling out everywhere. And so I think for both the physical, mental, sexual health of a lot of these patients, they feel so much better after having a labiaplasty. It's one of the procedures that I feel like I have the highest satisfaction rate with. Almost every single patient is thrilled, overjoyed with their result, and they can't believe how much better, more confident they feel with such a simple little procedure. We do it in office, so you don't need to go to sleep. Most of my patients are extremely, extremely comfortable the entire time and hardly feel anything with the local numbing medication because we use a topical numbing first. And then I go in with insulin syringes because I am a female. I've had babies. I understand how sensitive that area can be. So I take a little bit of extra care to make sure that patients are comfortable whenever they're undergoing the procedure. Now, it is a little bit painful for the first couple days afterwards, but after that, the recovery is pretty easy. Just 6 weeks of no intercourse, nothing per vagina. And patients do, like I said, exceedingly well and are very, very happy with the results.
And you guys want to know how we know they're happy? We usually will see them for the procedure. We'll see them for consultation, pre-op, see them for the procedure, maybe 2 post-op visits, and then we don't hear from them anymore. They're gone. They're happy. They're satisfied.
Until we post something about labiaplasty, and then you get like 50 people who are like secretly liking it so hard, and you're like, oh yeah, those are all the patients that had labiaplasty. Not to out any of them. They're like, that's my patient, that's my patient, that's my patient. Like all of them are liking it.
Okay, so that little procedure can really make a difference if it's something that bothers you. And I know a lot of women didn't know about it. I'm happy to have Dr. Andry on here and talk about it. It almost feels a little liberating, kind of, out here.
Yeah, to say the labia word on some kind of social media
to
platform.
say labiaplasty.
I know, right?
It's a safe zone here. We don't judge. We're empowering. So if you want to have this procedure done to make yourself feel better, do it. Go get it done.
Absolutely. And then with vaginoplasty, just like really briefly on that, a lot of women get stretched out after childbirth. They had big babies. Babies got stuck in the birth canal. So they're just very stretched out down there. They can't feel their partner. They have a little bit of urinary incontinence. Even some things like vaginal flatulence can happen. All these things are just normal. They're things that happen to patients afterwards. Nobody talks about it, especially the vaginal flatulence thing. Like people think that they're so weird for having that. And it's just
normal.
It's so normal, but it's just so embarrassing to people. And then for us to kind of tighten that up, fix it, make it, tighter down there. It's again, very liberating for some women. They didn't know that existed. And it is an option for patients.
Thank you, Dr. Andry, for talking to us about that. Okay. So to finish this off, I know this is going to be really hard for you, but if you could give our listeners that are on their plastic surgery journey one piece of advice, what would it be?
I would say just make sure that you click with your surgeon, because it's a relationship that needs to be built on trust. It needs to be built on the same aesthetic. You need to understand each other. And just as much as you are picking your plastic surgeon's kind of picking you as well. We turn down patients for surgery at times just because we just don't think that we can give them that result that they're looking for. And so I feel like you just really have to build that trust, because if the trust isn't there beforehand, it's not going to be there after surgery.
And that trust absolutely needs to be there after surgery, because that is when you are healing, you're in pain, you have soreness, you have bruising, you have swelling, you have doubt. So if you trust your plastic surgeon, you will believe them when they tell you, you're going to be fine. This is okay. This is normal.
Or we're going through a little bump in the road. If you have a complication, or we have a bump in the road, it's fine. Every single surgeon has a complication. If they tell you that they don't have complications, that should be a huge red flag, because they're lying to you. Mm-hmm. Everyone has complications. Not every patient, but every surgeon has had a complication. And it's just how they deal with it, how they're going to hold your hand and get you through it and eventually get you to that final result.
Because on that point, if they don't have time to see you for initial consultation, sorry to go back, but if they don't have time to see you for an initial consultation and pre-op, are they going to have time to see you if you have any type of complication? Probably not.
And that may be why some surgeons don't think that they have any complications, is because they just don't see their complications afterwards. The other plastic surgeons around town are seeing them.
That's right.
and that again should be a huge red flag, in that you want somebody who is going to be there with you through the whole thing.
Because as much as we advocate, you can have your plastic surgery, and I want women who want to do it to feel empowered in their decision and have it done. But there's a lot of risks involved. It's a cosmetic procedure. It's not, a life-threatening surgery that you need to have. So you can take your time and really do your research and really, find the perfect fit for you.
Mm-hmm. I completely agree. And you also need to come into something whenever you're in the right headspace, because so much of your recovery is mental just as much as physical. And so if you're not in that right mental headspace, you're not going to be at the point where you're taking care of yourself like you should be. And I am a complete, believer in that. If you're stressed out, if you're not in a good mental headspace, that cortisol level is way up, and that's going to affect your healing. It's going to affect your inflammation, all those kind of things. So you need to be at the best point mentally to undergo a procedure, because a lot of people, even if they're coming in with a great mindset, they go through some depression and anxiety after surgery, and that's completely normal and seen in a lot of patients. I actually want more research and more studies to be done about that, the depression that people have after surgery, because it's so real and it's so common. But if you're already starting off at a very stressed out, anxious, depressed state before surgery, it is not a good time for surgery.
And it's not going to change after.
No, do not have plastic surgery right after a divorce or right after you just found out that your husband cheated on you, or right after, somebody dies, or,
You're reiterating. I have a whole episode called Am I emotionally ready for surgery? You beat me to it.
Yeah,
so
sorry.
All of this is going to be in that episode of checking in with yourself
mm-hmm.
and having these conversations by yourself in the car, or, while you're washing the dishes, having an internal conversation with yourself. Am I ready? Am I really ready? Have I done my research? Do I feel confident? Could I do more research, or is my plastic surgery and answering all of my questions? Who's going to take care of my kids? All of these things need to be thought of before.
Yes. And please don't think about this 2 days before your surgery and then call and tell us, hey, I need to cancel my surgery. I'm not in a good headspace. This should be done before even scheduling your surgery.
Yes, definitely. But if you're in that headspace, right? If you're not in the right headspace, but you've had your 3 consultations, you know your surgeon, you know who you're going to pick, and then you can just work on yourself, work on your, mental state, knowing that when you're ready, they'll be there. They'll be there waiting for you and they'll be ready. And that's going to be the best time for y'all to work together. When you're in a good headspace, your surgeon understands you and y'all can together as a team work towards your body goals. Okay, Dr. Andry, for our listeners who are in Houston and they want to reach out to you, where do you want them to go?
So the easiest way to get an appointment is to call our office Monday through Friday, 9 to 5. The number is 832-900-7070. You can also contact us on Instagram. My handle is Dr. Andry, Andry. And you can find me there. I'm sure that Mavi can kind of throw a link up.
Yeah, I'm gonna link up your website.
And then also through our website, you can click the contact us page and you'll receive a text. Somebody will reach out to you via text within a couple days.
All right. Perfect. All right. Thank you so much, Dr. Andry, for coming and talking to us. I hope to talk to you again soon.
Perfect. Thank you, Mavi.
You're welcome. Bye.
Bye.
I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.